Hello and welcome. You are here following a conversation with your provider about the possibility of having a child with Duchenne Muscular Dystrophy. This video is intended to help you gain an understanding of this condition in order to make an informed decision about your pregnancy or simply provide you with the information to support your child as they grow. So now let's talk through some of the basics of the disease. Duchenne muscular dystrophy is a muscular condition that is X-linked and typically passed down by the mother to their male offspring. If you are not aware of your status as a carrier, you can follow up with your provider to perform a simple genetic test to determine your status. The mutation associated with DMD is a mutation of the dystrophin protein, which is the largest gene known in the human body. The protein itself links the actin filaments found in muscle cells to the dystroglycan complex within the cellular membrane that attaches to the extracellular matrix. These attachments are what permit muscle cells to contract and produce everyday movement. The severity of the disease depends on the mutation that a patient has. A mutation on the ends of the protein, which are important for binding, may affect protein function and present a more severe form of the disease. A mutation found within the middle of the long protein may lead to a less severe condition that can be treated. Due to its role in muscle cells, patients with a dystrophin mutation may exhibit impaired function primarily within the muscle cells, but secondary symptoms in cognitive function or cardiac and respiratory function may be seen as well. Common symptoms of this disease include frequent falls, difficulty rising from a laying or sitting position, trouble running and jumping, a waddling gait with walking on the toes and enlarged calf muscles, muscle pain and stiffness, learning disabilities, and delayed growth. While patients with DMD have a projected life expectancy of about 15 to 30 years, patients with this condition are perfectly capable of living a long and happy life. Now, here is what you should look for if you suspect your child may have DMD.
While the average age of DMD diagnosis is 4 years, here are some symptoms you can look for in the earlier stages of your baby's life. At birth, your baby will likely look very normal with no physical abnormalities. The first symptom you may see is delayed development, and if this is your first child, distinguishing it may be a bit harder. The following are developmental milestones to keep an eye out for. From 1 to 3 months of age, your baby should be smiling, be able to raise their head and chest when on their belly, bring their hands to their mouth, and hold objects in their hands. From 3 to 6 months, your baby should be able to roll over, reach for and grab items with their hands, and will be attempting to speak, babbling. Between 6 to 9 months, your baby should start crawling, respond to familiar sounds, and be able to play simple games like peekaboo, and stand up with support from external objects. From 9 to 12 months, they may begin taking their first steps and begin talking. While every child may have their own developmental timeline and not be perfectly aligned with the timeline listed above, you can always check in with your provider if you have concerns. A sample childhood development timeline will be included in your package for your reference. After the first year of life, you will notice more distinct physical changes in your child, such as progressive muscle weakness or reduced muscle mass, especially in the legs. You may notice enlarged calves with toe walking, difficulty climbing stairs and trouble standing, a waddling gait with forward-leaning hips, progressive difficulty walking, fatigue, and muscle tightness or soreness. You may also see cognitive impairment, such as delayed speech, or other symptoms like difficulty breathing. If you see any of these symptoms, you should take your child in for a checkup with their primary care provider and ask about the following. Have your provider check your child's creatine kinase or CK levels, which should be less than 200 units. You can ask them to check their genes through sequencing to determine if there is a mutation in their dystrophin gene, and this may also help in determining potential therapies that may be accessible later on. There are a series of physical examinations that can be made to test their muscle function, such as the North Star Ambulatory Assessment. Next, we will look at how to support your child if you receive a positive diagnosis for DMD.
Go to a DMD clinic where multidisciplinary care is practiced. A well-rounded team of medical professionals who practice various specialties, including a pediatrician, neurologist, orthopedist, cardiologist, pulmonologist, and GI. Schedule regular checkups to monitor your child's health and identify any potential issues early on. This can help manage complications associated with DMD, such as cardiac and respiratory problems. Next, it is important to discuss symptom management approaches with your care team. Common medications include corticosteroids such as prednisone and deflazacort. These medications improve strength and muscle function of DMD patients due to their anti-inflammatory properties. However, there are also important side effects to consider, such as bone loss, weight gain, stunted growth, and immune suppression. Most physicians suggest the use of steroids despite the well-documented side effects because the long-term benefits outweigh the side effects. It is crucial that your child starts physical therapy. Consult with a physical therapist who specializes in DMD to create an exercise program tailored to your child's needs. Physical therapy can help manage muscle weakness, maintain joint flexibility, and delay the progression of contractures. Regular stretching and low-impact exercises may be recommended. Low-impact exercises include swimming. In a pool, gravity is eliminated and does not act on muscles, which means additional stress isn't added onto the child's muscles. In addition, nutrition for weight optimization and maintaining bone health is extremely important. As your child loses the ability to ambulate, it is important to ensure good bone health by nutrition and vitamin D/calcium supplementation. Foods rich in calcium and vitamin D include milk and dairy products, egg yolks, mushrooms, and dark green vegetables like kale, spinach, okra, and collards. Next, the use of assistive devices and mobility aids such as braces, wheelchairs, or scooters should be considered to enhance your child's independence and mobility. These devices can help with day-to-day activities and reduce the risk of falls. When your child is still able to walk, night splints should be used to maintain ankle stability and range of motion. As symptoms progress, scooters and power wheelchairs can be used to help your child maintain some semblance of independence. Lastly, mobile arm supports can be extremely helpful. These support your child's forearms and let your child type and feed themselves. Provide emotional support and create a supportive environment for your child. Encourage open communication and allow them to express their feelings. Connecting with support groups or organizations specializing in DMD can also provide opportunities for your child to interact with others facing similar challenges. Lastly, it is important to realize that there are so many steps and precautions that need to be taken to help your child maintain a healthy lifestyle. However, your child is not his illness. It would be beneficial to allow your child to spend time on activities and hobbies that he takes an interest in, whether that be building Legos or playing video games. Going out to movies, family dinners, or even hanging out with friends at a park will allow your child to maintain a healthy social life and independence.
This concludes our introductory video into caring for a child with Duchenne Muscular Dystrophy.